The gentle, flowing movements of Tai Chi contain much internal strength. Like a river with flowing water, beneath the surface there is a current with immense power.
Hello, I'm Paul Lam. The reason I started doing Tai Chi was to help manage my own arthritis, which I developed at my early teens. It is very unusual to develop osteoarthritis at such a young age. I believe it was due to what happened to me at my childhood. I grew up in a small village in China near Guangzhou. My grandfather built this house where my family lives. When I was 2 years old, the communists came and forced us out, making us live in this small storage room. Since then, for 14 years, we have struggled against starvation and deprivation. The malnutrition from these years of starvation have left me with poorly developed cartilage inside the joint, which lead to arthritis in my early teens. Tai Chi has transformed my life. I want to share it with more people.
New ideas often attract skepticism.
Doctors have not known much about Tai Chi. They've not learned anything about it in medical schools, and doctors have a built-in skepticism about anything that's done without research that supports it.
We're uneasy about using, interventions, drugs, physiotherapy, Tai Chi, anything, if we don't know whether it's doing any good for people, if we think it could be a waste of time. Now, to know whether things really work, you need to do properly designed studies.
I think on the most obvious level, it's that Dr. Lam's Tai Chi for Health program has medical studies to back it up. It's been tested all over the world and shown to be effective.
Professor Song has published several studies on the Tai Chi for Health programs.
Our team decided to do the randomized clinical trial because we do not know much about Tai Chi and we are not sure that if it works. So we want to control everything for our study to look at our outcome. So we divided them, randomized assignment with the computer program so that we are looking at them twice a week, let them do Tai Chi exercise and for 3 months. At the end, well, not at the end. We were looking at in the middle of measurement, and they already feel less pain, less stiffness, less difficulties in performing their daily activities. That was amazing, and everybody was surprised to see that. And at the end of the study, which was in 3 months, their muscle strength was enhanced. So we were all excited about the result. And we published that in Journal of Rheumatology, 2003.
I think that Tai Chi is really good for young people because it brings a peacefulness and a tranquility that is very good for young people, I think. Because when you're young, you sometimes you're trying to find yourself and you don't know exactly who you are and what you want. And I think practicing Tai Chi can help with that.
Because I used to go up the stairs on all fours and come down on my bottom. I was so bad. And gradually I improved to such a level that I thought, really, I could go for this and help other people. And that is what I did, and gained my instructor certificate in Ireland. And it's completely changed my life. I no longer go up the stairs on all fours. My balance is better. And I can do the kick, which I'm very proud of.
And I have the great privilege of working with a lot of older women. And very frustrated when I see that most of their lives are spent going to doctors because things are failing them. They can't see as well, they can't hear as well. They lose their balance and they fall and they break their hips, etc. And so I became interested in Tai Chi because I wanted to find something that would empower them, that would strengthen them, where they were thinking about how they were going to be stronger and have something more rather than losing something.
My involvement with Tai Chi actually begins with my own personal journey and my own health. It's really saved my life. And I think that because it's done so much for me, I feel it's important to help others. I think we all are going to express a very deep concern when we realize that we are all going to face sickness, illness, and our own mortality, whether it's with our parents, with someone we love, or our children.
The vision of sharing it with people around the world has driven me to work very hard. Together with 45 master trainers, we have trained over 8,000 teachers. Over the last 10 years, we have taught over 1 million people around the world.
Accident Compensation Corporation, known as ACC, is a New Zealand national government department. It has a no-fault policy and pays for any injuries incurred both at home and in the workplace. ACC has proactively sponsored Tai Chi classes across the country as medical studies show Tai Chi to be effective in preventing falls.
I would challenge you to try. Just to try and experience this directly. Don't worry about any of the philosophies or the myths or the questions or even the science of it. Just try it. And from your own direct experience, see how you feel.
People with disabilities, please try the Tai Chi. It really does work. And it almost brings me to tears to see people carrying on their lives the way they do when there is a really good alternative out there.
Tai Chi has changed my life, and it can change yours too if you're willing to try it. Inquire through your local Arthritis and Diabetes Association, doctors and other health professionals. Do spend some time to find out if a teacher is suitable for your needs. You can also go to my website for advice. Let Tai Chi be your road to health and harmony.